Hi, my name's Georgesen. I am an Omaha native. I have spent some time the last 7 years training in a few different places around the country. So I pursued both my dermatology residency and dermatopathology fellowship in starting out in New York City, and then I've been in Pittsburgh, Pennsylvania for the last 2 years. Dermatology and what I specialize in particularly, which is called dermatopathology, it's in some ways it's kind of like being a detective. So not only do I get a chance to examine the patient in the clinic, but also I'm a dermatopathologist. So if we do a procedure called a skin biopsy, we actually can examine the skin underneath a microscope. And so for me, it's kind of like building a body of evidence towards what I think the most likely diagnosis might be. As dermatologists, we see a lot of different things, and I see a lot of different conditions. Some of the more common things we see are things like acne, eczema, psoriasis, warts. But I also see patients with more complex and rare skin conditions. Sometimes that might even bring them into the hospital. And another thing that I'm sort of passionate about is keeping pace with having the patient care keep pace with the current technology that's available. So I'm committed to developing patient systems where we can utilize technology, whether it be through telemedicine or digitizing medical photography, to meet the needs of our patients in today's world. What I like about academic environments and also what I like about Nebraska medicine is there are a lot of different environments that have different strengths, whether it be things like research or teaching or developing new treatments. I think at academic institutions and specifically at Nebraska medicine, I've always been impressed with how all that is balanced, with the number one priority being patient care. I was always sort of inspired to be a physician from a pretty young age, I think mostly from my mom, who was a nurse. But I grew to become aware pretty quickly that it was a perfect environment for me, and the reason I like being a physician is because we are constantly in an environment where we're learning from each other. So every day I'm learning from my colleagues. I have an opportunity to teach both students and my patients, and then I make it a point to try and learn something from my patients every day, because I find that is very rewarding and it keeps things exciting.